For my assessment, I will first come into the room. I will wash my hands in front of the patient to make sure that they know that I'm not spreading germs from one room to another. I'll wash my hands vigorously with soap and water for at least 20 seconds. Hello, my name is Mandy. I'll be your nurse today.
My name's Samantha. It's nice to meet you.
It's nice to meet you. Can I get your name and your date of birth?
Samantha Crable, May 27th, 2000.
All right, thank you. The doctor has ordered me to do a full head-to-toe assessment. That means I'll be looking and feeling for anything abnormal.
Yes, ma'am.
I will also be asking you questions. Anything you say will be confidential. Is that okay?
Yes, ma'am.
Okay. Well, I'm going to go ahead and close the curtain for privacy. Your vital signs have already been taken, and your blood pressure is 120/80, and your heart rate is 88. Both of those are within normal limits, and they are close to your baseline. You have your temperature is 97.9, and your pulse ox registers 98%. So those are all good. Your respirations are 18. So those are all within normal limits. As we go today, I'm going to go ahead and be looking at your skin. I'm going to be checking for any lesions, bumps, bruising. Tell me if you have any tenderness. I'm also going to be checking for any tattoos or piercings. So let's go ahead and begin with your head. All right. No bumps, no lesions. Hair is clean. Warm to the touch. You've got a normal cephalic head. All right. Everything is symmetrical. Skin is uniform, no lesions. What happens if it's not symmetrical? Then we report that to the doctor. All right, I'm gonna check your cranial nerve number 5. That's your trigeminal. Trigeminal. Okay, and so close your eyes and tell me where I touch.
You touched my cheekbone. You touched my cheekbone again. You touched my chin.
Okay, and go ahead and clench your teeth together. All right, clench it again. Okay, let me feel. Clench it one more time. All right, and try to keep your mouth closed. All right, good. So your cranial nerve 5 is strong. Contractions are strong and equally bilateral. And I'm going to check your facial nerve, so smile for me. All right, this is cranial nerve. This is cranial nerve number 7. Go ahead and frown. Close your eyes. Raise your eyebrows. Show your teeth. And puff out your cheeks. All right, good. Your cranial nerve 7 is symmetrical, and your facial expressions are appropriate and no drooping. Very good. Close your eyes and try not to let me open them. All right, good. Okay, I'm going to continue to check your skin, warm and dry. All right, and going down to your nails, clean and intact. No clubbing. And capillary refill within 3 seconds. And that is bilaterally. All right, I'm going to go ahead and go back to your eyes. Eyes are symmetrical. You've got green eyes, and eyelashes. Eyelashes are evenly distributed, both on top and bottom. Eyebrows are present, coarse, the same color as your hair. All right, go ahead and cover one eye and look over there and tell me what you can read.
TLC.
All right, and what is the color on top?
Green.
And bottom?
Orange.
All right, cover your other eye. And what is the lowest line that you can read on the Snellen chart?
Supercalifragilisticexpialidocious.
And what is the color on the right?
Purple.
And the color on the left?
Pink.
All right, very good. All right, I was checking for your cranial nerve 2, your optic nerve. Very good. All right, we're going to go ahead and check your cranial nerve 3, 4, and 6. That's your oculomotor, your trochlear, and your abducens. So follow my finger with your eyes only. All right, very good.
Oh, you're moving faster.
Your 6 cardinal fields of gaze. They are intact, full, and without nystagmus. Very good. All right, I'm going to look at your pupils. I already told you the color. All right, and the size is about a 4. Go ahead and look straight ahead. I'm going to turn the lights out. All right, your pupils are equally round and reactive to light. Go ahead and follow this. All right, you've got near far accommodation. Very good. If I had an ophthalmoscope, then I would use it to look at the fundus of your eye. It will give me a good look at the fundus. All right, so I'm going to go ahead and check your ears. They are symmetrical. Tell me if you have any tenderness. No tenderness?
No.
All right, so no tenderness in the auricle or the mastoid process or the tragus. All right, they're warm without lesion. They have one set of piercings. They are elastic with immediate recoil. All right, I'm going to go ahead and look inside of your ear. Okay. No earwax. No.
Oh, really?
Very trace amounts of earwax, small. No foreign bodies. That's a good thing.
Yep, that's a great thing, actually.
Yes, it is. All right, and I'm going to give you a 2-syllable word and see if you can hear it. So close your other ear with your finger.
Disney.
All right, again.
Binky? Oh, Mickey.
All right. Okay, very good. All right, that was checking your cranial nerve. Your cranial nerve 8, your vestibulocochlear. If I had an otoscope, then I would look into your ear and get to see a better idea of your ear canal and your tympanic membrane, your eardrum. I'm going to go ahead and look at your nose. It's midline, no deviation. All right. Yep. I'm going to feel your sinuses, frontal and maxillary. Do you have any tenderness?
No.
All right.
What you're talking about.
All right, good. Go ahead and plug one nostril and breathe in. And plug the other one and breathe in. Okay, if I was going to test your cranial nerve 1, your olfactory nerve, I would have you do that, and I would put a familiar smell in front of you like vanilla, coffee, peppermint, or orange. All right, I'm going to check your mouth. Your lips are pink, moist, without cracks. I'm going to go ahead and look inside of your mouth. The mucosa is pink and wet, pink and moist. Teeth are all present, white and in good repair. No apparatuses. That's good. No appliances. Gingiva is full of color, pink, and without edema, without retractions, without bleeding, without lesions. Your palate, go ahead and stick your tongue down. All right. Your hard palate is white and with transverse rugae, and your soft palate is pinker and soft. Your tonsils are present and pink without swelling. Let me see. Stick your tongue out and say ah. All right. Your uvula is midline. It rises and falls with phonation, and that's testing your cranial nerve number 9 and 10, the glossopharyngeal and the vagus. Go ahead and stick out your tongue again. It's moist and roughened with the papillae, and the ventral surface is smooth, glistening with veins. Go ahead and lift it up. Smooth, glistening with veins. All right, saliva present. Stick your tongue out. Okay, it is midline, so your cranial nerve 12 is intact. That is your hypoglossal nerve. All right. Say light, tight, and dynamite.
Light, tight, and dynamite.
All right. I'm going to check your neck.
Oh my God.
Still looking at the skin, seeing if it's uniform as it goes from the face to the neck. No lesions, no scars. Your neck is symmetrical. Go ahead and move your head back, forward and back, side to side. All right. You have full range of motion with no sound, no audible or palpable crepitus. Your trapezius muscle and your sternocleidomastoid muscles are strong. Your cranial nerve 11, we're going to go ahead and test that with your spinal accessory. So rotate against resistance. Try to turn your head that way and this way and shrug. All right, very good. Your cranial nerve 11 is intact, equal and strong movements against resistance. All right, I'm going to go ahead and palpate your lymph nodes. Alright, these include the occipital, the posterior, auricular, the preauricular, the tonsillar, the submandibular, submental, superficial, cervical, posterior cervical, deep cervical, and supraclavicular. Alright, I'm going to go ahead and feel your carotid arteries one at a time. Okay, and I'm going to go ahead and listen with my stethoscope. Hold your breath with the bell. All right. Carotid pulses are strong and equal with regular rhythm without bruits. If you did have bruits, it could be hyperplasia of the thyroid, which might suggest hyperthyroidism.
Can I breathe?
Yes, you can breathe now. All right. Go ahead and turn this way. Okay. I'm still inspecting the skin of posterior thorax. All right. Still no bumps, no lesions, no bruising. All right. Your spine is midline and S-shaped. I'm going to palpate for lumps. Tell me if there's any pain, and I'm also palpating for tactile fremitus. 1, 2, 3, 4, and 5.
No.
Any pain or tenderness?
No, ma'am.
All right, I'm going to go ahead and auscultate. Go ahead and give me some deep breaths. And again. And again. 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 And again. And 2 more times. All right.
Dizzy.
Go ahead and breathe again. And again. Lateral breaths. And on the front, deep breath. And again. And again. And again. And again. And again. And last one. Okay. No crackles, no rails. Lung sounds are clear to auscultation bilaterally with no adventitious sounds. You can turn around now. Alright, I'm going to check your skin turgor. Alright, making sure that you are not dehydrated. Alright, go ahead and I'm going to step right here and talk through this. Alright, so if I was going to do an assessment on the breast, then I would have my patient go ahead and raise their arms, and I would assess the lymph nodes, making sure that there was no lymphadenopathy. I would check for the lateral, the central, posterior, and anterior axillary nodes. I would have my patient raise their arms and then put their hands on their waist and close their hands in front of them, and then hang just a little bit in front with their arms dangling and leaned forward. And I'd be checking to make sure that there were no dimpling or retractions. I would expect the areola and the nipples to be a little darker in color and averted. Make sure there's no masses or edema. And then I would go ahead and have them lay down and put their arms behind their head, or one arm behind their head, and go ahead and palpate in a vertical strip, or like spokes on a wheel, or a circular pattern, and make sure there's no discharge. And my findings would be, hopefully would be, no axillary nodes palpable, no masses, no tenderness, no nipple discharge. Alright, then I would go ahead and position my patient to do the mental status examination. So we would be checking the A, B, C, and T. I would ask them questions. I'd be looking at their appearance, see if they were dressed appropriately for age, gender, season. I would make sure that, let's see, I would ask them questions about their behavior, make sure that they were awake, alert, and oriented ×4. And I would ask about their cognitive ability. I would check their remote. So their remote memory and their past memory. So could you give me a diet recall of this morning?
A smoothie.
Okay. And can you tell me the your anniversary date?
November 24th.
Okay. And I'm going to give you 4 unrelated words. Orange, tree, car, and bell. Repeat them after me. Orange,
Orange,
tree,
tree,
car,
car,
and bell.
bell.
All right. In 5 minutes, I would ask you, what are your 4 words?
Orange, tree, car, bell.
Okay. And I would ask you that at 10 and 20 minutes. I would complete my mental status examination. And do you have any questions?
No, ma'am.
All right. Well, thank you very much. I appreciate it.
Thank you.
Goodbye.
Excuse me.
Did you get that?